It's feared reforms to America's Affordable Care Act will hit women hardest. From a return to higher premiums for women to gaps in coverage for birth control and breast pumps, the Republican push to repeal the Obama-era healthcare is already raising concerns. We're joined now by Dr. Mott Blair from the American Academy of Family Physicians. He's in Kansas City. Good evening to you. Tell us first of all how the Affordable Care Act changed the medical provisions for women specifically.
Thank you, and it's a pleasure to speak with you today. The Affordable Care Act has really allowed more access to the services that are really important for women, particularly preventive services, prenatal care, and ongoing contraceptive issues, particularly as a good example. And it's considered what we call an essential health benefit, which mandates that insurance plans have to provide these coverages for women.
And what was the situation previously? Women were potentially facing higher premiums than men because of specific needs.
Oh, absolutely. So there is a thing that we call parity now. That means that women are not penalized for being women in particular. And in the states, if you had a pre-existing condition, oftentimes your insurance could be denied based on those grounds at all. So what if you were a woman who had maybe had a C-section, or perhaps you had been a victim of domestic abuse? Your insurance could potentially be denied, which essentially shut down your access to the care that we really believe women deserve.
And what are you hearing about possible changes to the Affordable Care Act? What do you believe are the thoughts, the processes in place that will change the Act as you know it now?
Well, there certainly has been a lot of political dialogue and messaging around the Affordable Care Act. And it's no secret that the Republican administration and the Republicans in charge of Congress have said forever that they're going to appeal and replace the Affordable Care Act, or what's called in the states Obamacare. What the plans to come forward is we don't know. And one reason we are speaking out so strongly is that we know that there are things that need to be preserved, particularly these issues that wrap around women, that for them to get the care that they need.
You're saying that you actually don't have any detail, and you're not privy to how the Act might be repealed or how it might be changed. But what are your gravest fears?
Well, my bravest fears is that we will go back to pre-Affordable Care Act, where people could not get the care, could not get the coverage, where you could be denied your care based on pre-existing conditions, where you couldn't get preventative care, those kind of things. Your children couldn't have their preventative care visits. We don't need to go back to that step. Women in our country, I think, has come a long way. I think there's a lot at stake in the coming weeks and months in Washington, D.C.
So what are people in your position, other physicians, other doctors, what are they doing to make their concerns plain to the new administration?
So the organizations that represent primary care medicine, the American Academy of Pediatrics, ourselves, the American Academy of Family Physicians, there's 5 different organizations. We came together and made a joint statement of the things that we felt that were really important, specifically as it applies to women's health care. And that represented over 500,000 of physicians across this country who were making that statement that we believe this needs to be preserved.
And do you think it needs to be preserved in its entirety? Or are there any areas in which you think improvements could actually be made?
I think there's always areas where you can make improvements, and certainly the primary areas. What we don't want to do is go backwards. For instance, during the Affordable Care Act, Medicaid, which takes care of our most vulnerable citizens throughout the country, it was actually expanded in 31 different states. And that meant that there were 10 million people who had coverage for care, where before they simply had no coverage or access to care at all. So we do not want to go backward. And it's important to preserve the gains that we've made.
I mean, we obviously have a completely different system here with the National Health Service, but those 2 million that you're describing as being vulnerable with having no care at all, no cover at all previously, what did people like that do in the situation of need of medical care?
So surprising, the number's 10 million. The surprising thing is that what happens is those people do not have access to care. So what happens in the States when you have no insurance, no access to care, and no place to get care, you show up in the emergency departments of our hospitals. And oftentimes that's the inappropriate utilization of resources, and it's very expensive care. And we can actually do that in a much more efficient way when you have a family doctor or a medical home where you go in your community and get care from your doctor in your community. And that's what happens when you have a large volume of people who are uninsured or have no access.
OK, good to speak to you. Dr. Mott Blair, thank you for sharing your expertise and knowledge with us this evening. Thank you.
Thank you for having me as your guest.